In this video, we're going to talk about a very important topic, especially for pregnant women: the symptoms that can indicate a premature birth and how to identify them. Pregnancy is a journey full of expectations and surprises, and it's natural for doubts and concerns to arise along the way. One of the issues that generates the most anxiety among expectant mothers is the possibility of a premature birth. But how do you know if your body is showing signs that the baby might arrive prematurely? And what should you do if this happens? We're going to cover all this in this video in a clear and welcoming way, so that you feel prepared and informed about the signs that should alert you. Before we get into the symptoms, it's important to understand what characterizes a premature birth. Birth is considered premature when it happens before 37 completed weeks of gestation. This means that the baby is not yet fully developed, and therefore may need special care after birth. Although not every premature birth can be avoided, recognizing the signs that something is not right can help you seek medical help quickly and, in many cases, prolong the pregnancy, giving the baby more time to develop. Now, before you continue with the symptoms, have you made sure you're subscribed to the channel? That way you won't miss any upcoming videos and you'll be kept up to date with this incredible journey that is pregnancy. Now on to the main signs that may indicate a premature birth. The first of these, and perhaps the most common, is an increase in uterine contractions. During pregnancy, especially towards the end, it is normal for the uterus to have some mild, irregular contractions, known as Braxton Hicks contractions. These are like the body training for labor and usually don't indicate danger. However, if you start to feel frequent and regular contractions, which repeat every 10 minutes or less, this could be a warning sign. These contractions may or may not be painful, but the important thing to note is that they are happening rhythmically and with a constant frequency. If this is the case, it is essential to seek medical attention immediately, as it could be an indication that the body is preparing for childbirth. Another important sign that deserves attention is persistent lower back pain, especially when it is different from the normal pain that many pregnant women experience during pregnancy. During pregnancy, it is common for the weight of the baby and changes in posture to cause some discomfort in the back, especially in the last trimester. This type of pain is usually caused by the pressure that the uterus exerts on the spine and muscles, and usually improves with rest, changes of position, or massages. However, the back pain that can indicate a premature birth has different characteristics. It tends to be constant and acute, without relief with rest, and can intensify over time. An important aspect is that this pain can radiate to the lower abdomen, creating a cramping sensation that spreads down the back. This is because the body may be starting to prepare for labor, and the muscles and ligaments in the pelvic area are moving. In addition, back pain can be accompanied by a feeling of pressure in the pelvis, as if the baby is descending. This pressure is common towards the end of pregnancy, but if it happens much earlier, it can be a sign that the body is preparing for labor ahead of time. Many pregnant women describe this pressure as a feeling of heaviness or as if something is pushing down on them. If this pain is combined with regular contractions or vaginal bleeding, the situation should be treated even more seriously. Frequent contractions, even mild ones, together with intense back pain, can indicate that labor is beginning. The ideal is to seek medical help immediately so that the state of the cervix can be assessed and, if necessary, measures can be taken to delay labor and protect the baby's health. In addition, the sudden emptying of the amniotic sac, popularly known as a ruptured sac, is one of the clearest and most striking signs that labor may be about to begin. This rupture usually occurs unexpectedly and can be perceived as a sudden gush of clear or yellowish fluid coming out of the vagina, or even a constant drip that doesn't stop. The amount of fluid can vary, from an intense flow to something more discreet, but in either case, it's a warning that something important is happening. This fluid is the amniotic fluid, which surrounds and protects the baby inside the uterus throughout pregnancy. When the sac ruptures, the safe and sterile environment of the uterus is compromised, which can increase the risk of infections for both mother and baby. That's why, even if you're not yet feeling contractions or any other signs of labor, it's crucial to go to the hospital immediately. The medical team will assess the situation and decide whether it is necessary to induce labor or whether there are ways to safely prolong the pregnancy. A sign that often goes unnoticed is increased vaginal discharge. During pregnancy, it is normal for a woman to notice an increase in the amount of vaginal discharge, but if it becomes excessively liquid, thick, yellowish or greenish in color, or has a strong, different smell than usual, it could be a sign of infection or the rupture of the amniotic sac. This change in secretion may indicate that the body is preparing for labor ahead of time, in which case it is essential to consult your doctor to assess the situation. Another issue that may raise concerns is vaginal bleeding. Although small spots of blood may occasionally occur, especially after vaginal examinations or sexual intercourse, any heavier bleeding should be taken seriously. Bleeding, especially when accompanied by cramps or contractions, can be a sign that the cervix is dilating prematurely, which can lead to premature birth. If this happens, it's best to go to the emergency room immediately for a more detailed assessment. Now, a question for you. Have you ever had any of these symptoms, or do you know someone who has? Let us share our experiences and help other moms who may have the same doubts. In addition to the more obvious signs, such as contractions, back pain, rupture of the sac or bleeding, there are other lesser-known but equally important symptoms. A decrease in the baby's movements is one of them. Generally, mothers can notice a pattern in the baby's movements inside the belly, especially after the second trimester. If you notice that your baby is moving less than usual, this could be a warning sign. Although it doesn't always indicate a premature birth, decreased movement can suggest that the baby is in distress, and it's important to seek medical help to assess the situation. It's also worth noting the sensation of pressure in the pelvis or vagina, which can be very uncomfortable. This pressure occurs when the baby is descending into the birth canal, pushing against the bones and muscles of the pelvis. When this happens earlier than expected, it can be a sign that the body is preparing for a premature birth. This feeling of pressure is often described as a heaviness in the lower body, almost as if something is pushing down, and can be very noticeable, especially when walking or standing for long periods. This pressure is often accompanied by abdominal cramps, which resemble menstrual cramps. These cramps can vary in intensity, from mild and sporadic to stronger and more regular. It is essential not to ignore these symptoms, especially if they are new or more intense than usual, as they may be one of the first signs that the body is preparing for premature labor. Seeking medical advice at this time can make all the difference in prolonging your pregnancy and protecting your baby's health. But what should you do if you notice these symptoms? The first step is to stay calm. We know it's easier said than done, but it's essential not to panic and to act quickly. If you're experiencing regular contractions, intense pain, pelvic pressure, a ruptured sac, or any other worrying symptoms, contact your doctor or go to the nearest hospital. In many cases, especially if identified early, doctors may be able to administer medication to stop or delay labor, giving the baby more time to develop. In some situations, medication can also be administered to speed up the maturation of the baby's lungs, if premature birth is unavoidable. Another important point is to pay attention to your body's signals throughout pregnancy. Every woman and every pregnancy is unique, so it's normal for symptoms to vary from person to person. The most important thing is to get to know your body and understand what is normal for you. If anything seems out of the ordinary, don't hesitate to seek help. Prenatal care is essential to ensure that the pregnancy is taking place in a healthy way and, in the event of any changes, the doctor will be able to advise on the best course of action. Prevention also plays a key role in reducing the risk of premature birth. Some simple measures can help reduce the chances of your baby being born prematurely, such as eating a healthy diet, drinking plenty of water, avoiding excessive stress, and following all medical advice during pregnancy. In addition, if you have a history of premature births or other risk factors, your doctor may suggest more frequent monitoring or preventive treatments. Remember that even with all the care you take, premature birth can happen unexpectedly, and it's not the mother's fault. The most important thing is to be prepared and know how to spot the signs so that you can seek help as soon as possible. If this video was useful to you, don't forget to like it and share it with other moms who may be going through the same doubts. And of course, if you're not already subscribed to the channel, take the opportunity to subscribe now and follow all the upcoming videos on pregnancy and motherhood. Let's go on this journey together.